So I have schizoaffective disorder, which is a lot of people might not know about it because it's not very commonly talked about, but it's when you have all those symptoms of schizophrenia along with a mood disorder as well. So for me, I have the bipolar type. There's also the depressive type.
Gotcha.
And, but I think the main focus I want to talk about is schizophrenia because that's the one I think is like really not well known. I mean, I think bipolar is like people kind of understand it at least a little bit more than schizophrenia.
Sure.
So the first question I wanted to ask you is like, what's your like? Have you had like any experiences with someone who's like severely mental ill, like in person? I know you talk about like having emails with them and stuff.
In person one time maybe, but it was really hard to tell. I wasn't sure. But
Yeah,
not there was just one conversation with a guy that was kind of, but it's a long story. But yeah, but otherwise no, not much.
yeah. And then I think I heard you guys talk a little bit about your understanding of schizophrenia, but has anything changed since the last time you've talked about it?
Not too much, I don't think. No.
Okay, so I just thought I would start with like a brief overview, and I don't want to stay on it for too long because it can be boring for a lot of people.
Yeah, you're fine.
But schizophrenia is basically like has three categories of symptoms. It has positive symptoms, and positive symptoms mean in addition to your human experience that other people don't.
Mm-hmm.
And then a negative symptom is the inverse, where you don't experience what other people do. So positive symptoms would be like delusions, hallucinations, and like psychosis, being out of touch with reality.
Mm-hmm.
And then the negative symptoms, there's 5 A's. They have like these words that I can't pronounce very well, but it's like flattening effect of your face, like not many
Yeah.
facial expressions, like poverty of speech, no desire to do anything, no interest, lack of joy, kind of similar to what people experience with depression in a way.
Okay.
And then you have the cognitive symptoms, and that's like memory issues. You have difficult understanding new information, more just in a way kind of similar to ADHD, kind of, if
Sure.
that makes sense.
Yeah.
So, um, and I did want to mention, so I saw the other guy was talking about, what's that guy's name? Schizophrenic hippie? Is that what his name is?
Fuck, I don't remember the last guy that I chatted with. Or no, or he was talking about the guy with the YouTube videos. That guy?
Yeah.
Yeah, yeah. What about him?
Yeah, I've seen that before.
Mm-hmm.
And I have like a very small YouTube channel, just to try to, kind of talk about these things and focus on how society like sees these things.
Mm-hmm.
And I, have a good friend who also makes YouTube videos. He's schizophrenic, and I've talked to other people. And what I've found is like and this is like true, like when they do studies on it, is like usually the older you get, the less severe your positive symptoms become,
Yeah, I've heard this.
and you
Yeah.
have more insight into that you're having them. So it's like like I said, like he said, I'm not accusing the guy of not being schizophrenic. I might accuse him of like playing it up a little for the camera, because usually if you're on your medication and you're, coherent enough that you have a mental illness,
Mm-hmm.
when you have a hallucination in that state of mind, when you're not in psychosis, as like you can have hallucinations and delusions without being in a psychotic episode.
Okay.
So, if he wasn't in a psychotic episode, I can't imagine seeing a hallucination, being cognitively aware that you have a rare mental illness, brain disorder, and crying at the hallucination, because most people would be aware of the fact that's a hallucination, because it's you logically kind of put it together in your head, like A, I have schizophrenia, B, I don't believe in ghosts or whatever, and C, like um I've seen ghosts before and I weren't there,
Mm-hmm.
Does that make sense?
Yeah, makes perfect sense. You're saying that as you get older, with time, you kind of learn how to tell like what's a hallucination and what's not, and that if you're having a hallucination outside of like a psychotic episode, you would see it, you'd maybe be like a little bit irked, but you would understand it's not real, and then you just kind of move on. But like having a huge emotionally dysfunctional like reaction to it is probably only going to happen inside of a psychotic state.
Exactly. And another thing, like, so there was a while back, I made some videos. I took them down because it's hard when you experience mental illness every day of your life. But Anthony Padilla made like a video where he was talking. Do you know who Anthony Padilla is?
I don't know. Who's that?
He's like, you know, a guy from Smosh. He does like interviews now.
Fuck,
It's
I
like
don't. But
old
I don't know
YouTube.
anybody. I don't watch anything. So, but yeah.
Anyways, he was doing interviews with like schizophrenics and
Oh
oh God,
wait, is he the guy that does the channel where he interviews people with different mental illnesses?
yeah,
Oh, then I
yeah.
think I might have seen him.
But I had such a big problem with that, those lines of videos. It was hard because I was trying to react to them, but it was difficult because you ended up just kind of critiquing the people telling their story, and so I thought it was wrong, so I took it down. But
Sure. Okay. Okay.
one of
Never
my
mind. I'm thinking of
biggest,
a guy that does like special books or something. That's the special books guy. Never mind. Sorry.
oh,
Okay.
like that guy's super nice. Yeah,
Oh,
he's a
okay.
really
Yeah.
sweet
Okay.
guy.
That's who I'd seen. But okay. Gotcha.
Yeah, he's a sweet guy. But they never at any point talked about how medication works for people with schizophrenia or any treatment. They only talked about like the frustrating part for a lot of people I've talked to is that people only talk about hallucinations and delusions in psychosis.
Yeah, that's so. The last guy that I talked to, that's something that I hadn't really considered before. But the last guy that I talked to that was on here, the one that you listened to, the thing that he was emphasizing more and more was that the negative symptoms were like way, way, way worse than anything else, or at the very least, they like also amplified the fuck out of everything else, which I hadn't really considered before. Like the memory problems and then especially the sleep thing, he emphasized a lot too.
Yes, sleep can be really, really annoying, but and I do want to talk about that because it is pretty interesting. But with medications nowadays, well, ever since they came out with antipsychotics, that was one of the big reasons that mental hospitals closed down in the first place was because there was like a viable treatment for schizophrenia, and like I forget the percent. It was a large percent of hospitals were filled with like patient patients with schizophrenia. They work really well for positive symptoms, but they don't do anything for negative symptoms. Very rarely will they help with the negative symptoms at all.
Are you talking about the medication?
The
Okay, gotcha,
medication.
gotcha. Okay.
But there's this stereotype that schizophrenics always stop taking their medication. And I don't think people really grasp how difficult of a decision it is to keep taking your medication. And as a disclaimer, I think everyone should stay on their medication and listen to their doctor. I'm not a doctor. And I read a lot about it and I try to read many studies, but I still listen to my doctor. I still, you know, follow the rules and it works out really, really well for me. But they have such like life-changing side effects like and it's like I mean I've talked to people who have depression and then they're like, oh, I stopped taking my antidepressants because I couldn't get a boner anymore, and I'm just like, well, now I'm stuck on these medications that made me gain 60 pounds in a year, give me permanent movement disorders, completely change my hormones so I can't get pregnant, but I have, do you see how that's frustrating?
Yeah, I've known a lot of people that have done like the SSRI train, kind of like trying to find different medications. Sometimes antipsychotics are even prescribed for things like OCD and whatnot. So I'm familiar with people that have like tried these drugs and the side effects that come with them. Yeah. Or I knew one girl that like she could get horny and she could orgasm, but it would take like 3 hours literally together. Just like a whole bunch of like weird side effects like that could affect people. Or the weight gain one is a really big one, where somebody will get on a certain type of either antipsychotic or SSRI, and then they'll gain like 50 pounds, and it'll be like horrible. Yeah.
Yeah, I would say the worst of all is the movement disorders.
I haven't heard that
So
at all before. Yeah. What do you mean by
oh,
that?
it's definitely the completely the worst.
Okay.
So it's let me know if I'm boring anyone,
No,
but
no, you're good.
basically there's a lot of evidence coming out that schizophrenia is more of a brain disorder or a neurological disorder than a mental illness, but we still kind of categorize it as a mental illness since it has a lot of psychological features. But basically there's the dopamine hypothesis. It's the most popular belief. So basically they think there's too much dopamine somewhere in the brain. They think the prefrontal cortex mainly. And this can be seen pretty clearly through patients like who have Parkinson's, right? So there's this uh, doctor, I used to read his books all the time, named Oliver Sacks, and he, you know, was working with patients with Parkinson's and all these movement disorders, and he found that when he gave them L-Dopa, which raised their dopamine, that it was cured, like their movement problems were cured.
Okay.
But when they gave them too much L-Dopa, they completely mimicked psychosis completely. So that's one side of the theory. The other side of the theory is antipsychotics lower the dopamine in your brain. They block the dopamine receptors. That's all they do, really. I mean, like the newer generations mess with some other neurotransmitters, but mainly the biggest thing is it lowers the amount of dopamine in your brain. So if you can kind of put it together, once you start depleting the dopamine in your brain, your hallucinations and delusions will go away because that's what's causing it. But in the part of your brain where movement is really, really um, caused by dopamine, like dopamine aids in movement,
Gotcha.
you start mimicking those disorders as well. So you can have like, it can show up as Parkinson's. There's something called akathisia. So akathisia is like, have you ever had like restless leg syndrome?
I don't like my leg. Like I like move my leg a lot, but as like a habit. I don't think I've ever had restless leg syndrome. No, because it's more than that,
So
right?
yeah, and akathisia is like a step above that. So it's
Mhm.
like this feeling in your limbs mainly where it just feels almost kind of like, it's hard to explain to a lot of people, but it's like almost like electric currents, like really, really, really horribly uncomfortable. And the only thing that relieves that feeling is moving around. So like, I mean, some days
Okay.
there's like one day I was at work and I put in 16,000 steps just pacing around the office because it was so bad in my legs. Like it's just the most uncomfortable feeling.
Hmm.
It can cause people so much anxiety that they kill themselves over the akathisia, not the illness itself.
Hmm.
And then there's tardive dyskinesia, which I had a really big problem with because my tongue would flick in my mouth like really, really fast all day. Just and I had no control over it. It was completely just the muscle just spasming on my tongue all day long.
Hmm.
And that's just like, oh, like the scariest things and why I think the movement disorders are the toughest thing to get over is because they're permanent. Like weight loss, you can get off the meds, you can do the diet, like, because at the end of the day, it's calories in and calories out for the main part. But when you have these movement disorders, if you're on antipsychotics for like 10, 20 years,
Hmm.
even if you stop them and discontinue it, you could still permanently have those movement disorders.
Gotcha.
Mhm. So, um,
Is that and that's not caused by the schizophrenia? That's caused by the medication.
yeah, it's caused by the antipsychotics lowering the dopamine in the part of, because when it lowers the dopamine, it doesn't just lower the dopamine in your prefrontal cortex. It lowers the dopamine in your entire brain, so it's affecting the movement.
Yeah, I gotcha.
Um,
One of the things that
so
I'll just say this here for people listening. One thing that's kind of annoying is people will talk about like dopamine is like the reward like chemical, or like serotonin is like the happiness neurochemical or neurotransmitter. But my understanding is that like these neurotransmitters, all of these are available, or they're involved in tons of different functions in the body. Like serotonin is like over 100 things that it like regulates and controls and everything. So it's not just like one chemical that you need to increase or decrease, and then it fixes problems or gets rid of everything, right?
yeah, for sure. And then the worst part was years ago before they figured out why people were having schizophrenics were having these movement problems. They did think it was the schizophrenia. So instead of discontinuing the medication, they'd actually raise the medication, making it much, much worse. So
Mm-hmm.
yeah, but um, when it comes for medication, um, it's really important. It's important to me. I gonna say I do want to talk about the medications I take, but every medication works differently for every person, and everyone needs a different dose.
Mm-hmm.
And I think a big problem that schizophrenics come across is doctors aren't really open with the side effects you'll experience. I don't know why, at least mine didn't explain that these things could be permanent or these things happen or any of it. It just started happening to me.
Mm-hmm.
So it's good to read up on those things. And also, if you're experiencing something that's abnormal, even if it's not related to the antipsychotics, it's probably a good thing to bring it up to your doctor because they might know and it might actually be a side effect. So I take 80 milligrams of Latuda, 2 milligrams of risperidone, so those are two antipsychotics, and then I take 125 milligrams of lamotrigine, which is a mood stabilizer, and then I take benztropine to deal with. So I have a prescription just to deal with the movement issues caused by the antipsychotic. They're
Gotcha.
usually prescribed to people with Parkinson's. And then I have to take birth control just to regulate my hormones because antipsychotics also really mess with your prolactin levels, which can affect the other hormone levels in your system.
Mm-hmm. Okay. Gotcha. Gotcha. Um, with your stuff, how it's set up now, are you like pretty? Did I misunderstand earlier? Did you say there's not really medication you can take for the negative symptoms?
Right, but I've never. So for me, it has negative symptoms actually sometimes get worse as you age, but for me, I also have, and it doesn't work for most people. I don't know why it works. Everyone's brain chemistry is just different. I also have an Adderall prescription, and I wish everyone with schizophrenia could take it because it really helps with the negative symptoms, like a ton,
Mm-hmm.
a lot. But it's obviously raises the dopamine in your brain. It's just pretty much as simple as that. Anything that raises your dopamine in your brain can really offset and cause a psychotic episode. But for some reason, it works for me, so that helps a lot. But as I grow older, it's just like I enjoy things a lot less. Like it's very hard. Like I used to go on walks all the time and stuff, and now when I look at nature, it's just like blah, you know, it's just like everything's blah all the time. Eating
Yeah.
food, blah. You know, you have to do all these things. Um, I don't, you know, for me. So I did want to ask you this. You know, Mr. Girl and the whole Dr. K situation.
Yeah.
You know how, you know, Max will be all like, his opinion on suicide is just as bad as like murder and rape,
That
right?
suicide is just as bad as murder and rape. Okay.
What's your opinion on that?
Um, on whether or not it's as bad or, as murder or rape.
No, just mostly like, hmm, yeah, maybe. Just kind of like how do you think it affects us? Like, do you think it should be frowned upon or
That's a
in
really,
like,
really, really hard question. I mean, in a perfect world, I think suicide should only be done by people that are approaching end of life and have like no more medical alternatives to alleviate suffering, right? I think that's a very appropriate time for suicide. I would hope that for anybody that hasn't met that threshold or those conditions, that there are other alternatives available such that a person shouldn't have to commit suicide to escape, whatever suffering they have.
yeah, because I, you know, have definitely had a lot. So I started my email with I'm very high functioning, which I definitely am, but when I'm having a pretty bad episode, things do get really rough, and when the negative symptoms are really bad, they get really rough.
Yeah.
So, but even if it's not like 100% true, I do like to think that it's as bad as murder and rape because it destroys your family. And even if that's not necessarily true, I like to keep it in my head because then it motivates me in a way. Like if you realize you got kind of have to live through life, right? And you need money to live through life, so you have to work a job. And then you have your family, so you have to take care of yourself. It's almost like it's that kind of mindset almost forces people who have mental illness to be like, I got to get off my ass because you have to live through it anyways. And that's kind of the way I cope with negative symptoms. Does that make sense?
Yeah, I mean, if that helps, then I mean, that's valid. I mean, yeah, I can't
Yeah.
argue it. Yeah, sure.
Yeah. I'm just like, okay, I have to do these things because you kind of born and it's like whatever deck of cards, you know, you get, hand of cards you get in life, and you kind of have to work with it.
Yeah.
So, but the negative symptoms, when it gets bad, it's like I don't do my dishes for like 3 weeks and stuff like that. I'm just kind of like laying around a lot and stuff. So, it's pretty difficult. Like I lived by myself for like about 6 months, moving back into my family's now because I got really, really depressed, and I was like, okay, I know that that's not good. So I have to be with people who can help me out because, you know, no matter how high functioning you are, it's a pretty severe illness. So there are times where you're just disabled, and sometimes you're disabled from the medication because they make you tired as hell. Because they used to be classified as major tranquilizers actually, because they just knock you out. But when it
Can,
comes to like what?
I was gonna ask a question, but you can finish this.
No, go ahead.
Well, I was gonna ask, like, when you're having like big depressive episodes and stuff, like, what are the things that people can do that help you?
For me, it's just being surrounded by the people who love me helps a lot. You know, my family, like, you know, they can help me with the physical stuff, like helping me with my dishes and stuff and little things like that. But they also help me in the emotional sense of when I mean, I just learned with time that being alone when you're depressed is probably the worst thing you can do to yourself, really. It's
For sure.
very, yeah. So, I mean, so I went to therapy first time when I was 12. I think I was put on antidepressants when I was 13.
You went to
So
wait.
I've
What was the
been,
thing you just said? You went to therapy for what?
when I was 12,
When you were
I was
12? I
just
guess I
really
didn't.
depressed.
Gotcha.
Yeah.
Jeez. Okay. Do you think that
And I was,
when you were 12, do you think that that was part of like, or when did you first start experiencing stuff related to schizophrenia?
so yeah, so there's a prodromal system, not system, prodromal symptoms. So before your first psychotic episode, you'll have the prodromal symptoms. And that will be, and I experience this very heavily, like it's just when it looks like on the outside like a very, very bad case of depression,
Mm-hmm.
where you lay around a lot, you get really depressed, start socially isolating very heavily. And excuse me, it was around the age of 12 where that kind of started for me. So I started, like, it's a joke now in my family, but I guess they used to always go behind my back and everyone would say, like, doesn't Anna lay down more than anyone you've ever met? Like, they never thought anything was off about it. But severe social isolation, I would just get home, I'd play some music and lay in bed and just kind of sleep all the time. But
Mm-hmm.
I've been experiencing hallucinations since very early childhood. Very rarely, though, it wasn't like a constant thing. I would just hallucinate here and there because unlike other mental illnesses, schizophrenia is not something you can get over with therapy. You kind of need medication and things like that.
Sure.
And there's actually genetic precursors that they've found. Like there's
I've heard it's like a
one of the,
super heritable. Like if you've got like an uncle or an aunt, it like dramatically increases the chance of you developing it.
yeah, it runs my family. I think in identical twins, it's like 30 to 50% chance the other twin will have schizophrenia. So it's very, very heritable because there's actual genes that they've only found in people who develop schizophrenia. So it's actually like there's no like PTSD gene.
Yeah, yeah.
You know, it's that's why I like to think of it more as a brain disorder than a mental illness because your brain is actually shaped differently. Like like 80% of people who have schizophrenia, when they autopsy them, they have bigger ventricles in their brain and less white matter, I think, in their brain as well.
Gotcha.
So it's a lot of people don't know that kind of stuff. So
Someone in
yeah.
chat just asked, what's the difference between a brain disorder and a mental illness? So mental illnesses are typically things that through some combination of, or one or the other, either therapy or medication, eventually, hopefully you can get over. So like somebody might be able to say like, I had PTSD, I don't have it anymore. I had depression, I don't have it anymore. I had anxiety, I don't have it anymore. But for like schizophrenia, it's a bit more of like a brain, like a physiological thing, because you never like are over your schizophrenia. Like there's not like a point in time where you're like, oh, like I had schizophrenia when I was younger and I cured it.
I mean, there's chances it'll go into remission, but that's mostly for positive symptoms. You're usually stuck with the negatives for the rest of your life, and it's more like if you want to think of other brain disorders, it'd be like Parkinson's and Alzheimer's and
Sure.
dementia. There's something abnormal about your brain. It's like a neurological disorder. If that makes sense.
Do you take anything to like help you sleep or anything, like melatonin or heart or tranquilizers
Oh
or anything?
no, the antipsychotics, the risperidone, could probably knock out like a horse. Honestly,
Oh, okay.
they make you, yeah, they knock you out for really hard. But that's now we can get on the topic of sleep. Yeah, I was hoping to articulate like how difficult the sleeping thing could be, because well, mine's like kind of different because I also have bipolar too, so that really heavily affects your sleep as well. So, I mean, I go through pretty much phases, and it doesn't seem like I get much of a break from it. It's a little annoying, honestly. We've tried like everything, but I'll go like 2 or 3 months where I sleep 12 to 16 hours a day, just exhausted all day long. And then I'll go 2 to 3 months where I'm sleeping maybe 3 hours every night. Maybe. I mean, the longest I've gone without sleep is 4 days.
Jeez.
And in those times, like the last manic episode I had, I was up for those 4 days, and I'd be put on 100 milligrams of Latuda and 15 milligrams of Zyprexa, which is really high doses for both of them. That's when the tongue started flicking my mouth because of the movement disorder problem. So, and then I was like 60 pounds heavier, so it was real, and I was working from home, so it was really freaking tough because I knew I looked freaking weird, overweight, and like it was just a mess.
Do you mind saying?
Medication?
Do you disclose your age or?
Yeah, no, that's fine. I'm 23. I'm turning 24 next month.
Gotcha. Okay. Gotcha. Well, is there anything else you want to go over or?
Yeah, I just wanted to quickly go over the issues I have like with the way society kind of goes,
Yeah, sure.
like
Talking about schizophrenia.
looking at talking about mental illness in general. It's just like a little frustrating because like it is a very complex disorder, and it's very hard to understand, and I understand that.
Mm-hmm.
But it also seems like we don't, as a society, really care at all, because like the amount of homeless people that are schizophrenic, I think it's up to like 20% of the homeless population is schizophrenic,
Mm-hmm.
and like everyone's like worried about the violent schizophrenic, but schizophrenics are 14 times more likely to be a victim of a violent crime than perpetrate a violent crime.
Sure.
I mean, I've gone through life with like having friends that I thought were really close, and you tell them that you have like anything that has the word schizo in it, right?
Mm-hmm.
And their whole perception of you changes. They act like they're walking on eggshells all the time, and I hate that because I just want to be treated like every single other person. Now, granted, there are a lot of schizophrenics who, you know, have a very hard time blending into society, but it's just like hearing the name of the disorder itself just kind of completely changes
Mm-hmm.
your perception of a person, and that's annoying.
Do you think is there anything when people are dealing with you that they need to know that's helpful to avoid, I guess, like triggering anything? Or
Um, as long as you don't let me smoke too much weed or anything like that, I should be fine. I'm actually very, very hard to upset. Pretty much, like
mm-hmm.
I'm very like my coworker makes jokes about it, like you look like you got hit in the face with a shovel last night because I just look tired and stuff. Like it's really hard
Mm-hmm.
to upset me in that kind of way. Really, I mean, if you go on and on about conspiracy theories for too long, I might start getting a little paranoid,
Mm-hmm.
just because you know you just I think that's kind of for anyone though. Like, if you get too much into conspiracy theories, people kind of, you know,
Yeah,
get
maybe, yeah.
into, yeah.
Do
And then
I was gonna ask, do
what?
you smoke weed?
I used to all the time. I don't anymore, just because it makes me so anxious.
Mm-hmm.
And oh yeah, that was the other thing I wanted to touch on because you were asking the guy what it's the difference between like taking psychedelics is
Mm-hmm.
versus like hallucinating
Mm-hmm.
normally,
Mm-hmm.
if you can say that. Um
Hallucinating off drugs. Yeah.
yeah. So there's I would say, have you done shrooms and acid?
Yeah.
Yeah. So I would say it's more like acid than shrooms. I would say actually it's when I'm trying to explain what a psychosis feels like to someone, which I did in my email a little,
Mm-hmm.
I do like to say it's like if you took a ton of acid, it's like a bad acid trip basically with the lack, not as much euphoria, kind
Mm-hmm.
of
Gotcha.
seeing stuff like that. So that's my personal opinion because I have tried those things as well, and I don't know if my opinion is swayed by actually already experiencing hallucinations my whole life. I don't know if schizophrenics trip differently, but I would say that's a pretty good um indicate like feeling, like
Mm-hmm.
explaining that feeling. It's kind of like a lot of LSD bad trip.
Gotcha. Gotcha.
And then the last thing I wanted to say was that yeah, um I think like people are very good at being sensitive around mental illnesses that they can understand. And I know you've talked about it a couple times, like people don't really understand depression unless they've had depression and things like that.
Mm-hmm.
But I would say more generally, people know what like feel sad, so they can put like they can put themselves in that shoe a little bit.
Mm-hmm.
But when you're trying to explain a break with reality and like hallucinations and having no motivation to do anything, I think it's very difficult for people to grasp. So when they're trying to be very accepting of all of these other um, mental health problems, I think it's easier for them because I know these people, and I know I've talked to many of these people, and they see a homeless person like screaming at someone on the street,
Mm-hmm.
and they're not like, "Oh, be nicer to them," you know.
Mm-hmm.
So that's usually my
Yeah.
biggest gripe.
Although that might have more to do with just like stigma against homeless people rather than maybe mental illness. But yeah, it's pretty fucked up.
Hmm. Yeah, I think that's pretty much everything I wanted to go over.
Gotcha.
Yeah, if you have any questions or anyone has any questions, I don't mind.
No, I don't think so. For you, you don't really worry about the positive symptoms much. They don't bother you, or it's not like a big deal, or.
Um, yeah, no, it doesn't bother me at all. For most of the part, ever since I started medication, the only things I see are just like dots flying around, you know, things moving. sometimes it's annoying when I'm trying to work because I work a full-time job
Hmm.
and I'm trying to read the computer screen and everything's moving. Like that's annoying, but it's not like I'm
Do you,
disabled because of that.
is it only like visual stuff or?
I used to get a lot more auditory. When I was younger, I would get a lot of auditory, which was more common.
Hmm.
Chattering. I would hear music. I would um, hear just like it sounds like you're in a cafeteria full of people, but you're like in your car at night, kind of.
Yeah,
That kind of
interesting. That's
stuff.
what the last guy explained it as that. And usually when we think of auditory stuff, it's like a voice saying something to you. But yeah, he mentioned it was just like chatter. Yeah.
Yeah, that's why I get so frustrated with those interviews with schizophrenics, because like that was like the whole concept of my video I made about Antipsychotics, because like, he was only showing like people who were saying very severe symptoms that aren't as common, especially if you're medicated, and they weren't. So it almost worsened the stigma because they weren't saying like a lot of people with schizophrenia, you wouldn't even know there was anything wrong with them in the first place.
Hmm. It'd be
So
like talking about autism and only showing videos of like very low functioning autistic people that are like rolling around the room screaming and being like, "This is what
yeah,
autism is." Or it's like,
exactly.
sure, yeah, I
Yeah,
understand that.
yeah, it's super frustrating. Um,
Do you ever, for just one question, I guess, um, because I don't know if this is fair to say or if this makes sense at all, but it feels like when we talk about like hallucinations, um, or maybe when we talk about like psychosis, do you, like in one sense you have kind of like you see or hear things like that's a thing, but then in another sense there's kind of like an underlying mood of like a feeling of something. Do you think that those are like two different things, or do you only get like the hallucinations like you see something? Does that make sense what I'm
oh,
asking? Or do
you
you want
feel something's presence there?
not like you feel something's present, but like a feeling of maybe like a really paranoid feeling that like somebody is after you or knows something about you or that things aren't quite right or something like that. Like, are any of those types of underlying feelings things that schizophrenics get, or is it generally like your mood and your vibe and everything is pretty stable, and then you just kind of like see or hear things?
Depends if you're medicated or not medicated. So basically, I would say when you are medicated and you're in a more stable frame of mind, you can separate delusions from hallucinations. So hallucinations can be benign,
Hmm.
and even if their voice is talking to you, they should be like they're two completely different symptoms. Like they often correlate, but that doesn't mean they have to correlate. In fact, like if you look at the DSM, you don't have to hallucinate or have delusions to have schizophrenia. You need like one or the other, but you don't have to be delusional like to have schizophrenia, and you don't have to have hallucinations to have schizophrenia. So
Hmm.
you just need like I think 2 out of 5
Yeah, yeah,
categories
something like that.
of
Yeah.
symptoms.
Gotcha, gotcha.
So
Okay.
I
I was
mean, I
just curious because
used
there's
to
some people that
have
I talk to, and it's not so much the like that they're seeing or hearing things, is that they'll have like ideas that are like very big about like being angels or part of like a grander plan or stuff like that. And it's not like I can point to like, oh, they hallucinated that sort of stuff, but it's more just like these kind of like inner feelings that they have. Yeah.
yeah, their thoughts. Like
Hmm.
they're basically a delusion is a fixed belief that can't be changed with any facts that bring
Yeah.
come to the surface.
Hmm.
Hmm.
Gotcha. Okay. All right. I was just curious. You don't have that as much. It's just
Before I was medicated, honestly, like I'm on a pretty heavy dose of stuff, so
hmm.
I don't have hallucinations or delusions very much anymore at all.
Okay.
I'll have episodes here and there, but very rare.
Gotcha. Gotcha. And then you said you work like a normal job and everything now.
Yeah, I work as a production scheduler at a medical systems company, and there are weeks when you get into depressive states where it's very very hard to do your work.
Hmm.
Um, yeah, so I worked a full-time job. I got disability at the job, but that was the other thing is like even your therapists and doctors don't want you to tell your workplace or people you know that you have schizophrenia. Like they want you to be careful with sharing that information just because they know that it can really they'll I get the impression they think they'll try to get rid of you because it's very much a burden to a lot of people's minds
Hmm.
when 'cause
When you're just curious, when you're having like depressive episodes and it's hard to work, is there a way or what do you do to motivate yourself to work through that?
well, it's very very difficult to motivate myself to get through those.
Hmm.
I would say I do still work. I never take big times off of work. I've never been hospitalized or anything.
Hmm.
So I've consistently worked since I was like 16 years old. I've always worked a job.
Hmm.
But during those depressive times, I do a lot less work, but forcing myself to go to the office and just knowing, well, like where I sit, there's like a bunch of people who constantly have questions for me and stuff, and about like how production's running and stuff. So to a degree, I think a lot of the reasons I'm good at overcoming those things is because I really, really like helping people with stuff, and I really don't want to leave people hanging. It's just kind of a principle of mine. So I just kick my butt and I drink like 4 Red Bulls, basically. Drink a
Gotcha.
lot of Red Bull. That helps too. I think it's like a hard pill to swallow, but it's almost like when you have to go work out after 2 years of not working out. It's kind of like that when you have a depressive episode. You don't want to do it. You don't want to get out of bed. It sounds like the worst thing ever. It's hard to focus, but you just get out of your bed. You force yourself to do it, and that's the best advice. I mean, I think when I tell people what to do, especially if they're really, really depressed, I would tell them to start with like really small things, because this is kind of how I learned how to do it over the years. So, because when I used to be depressed, I would just stay home from work for a long time, but I started with like forcing myself to shower every day. I have good hygiene. A lot of schizophrenics have very poor hygiene due to their negative symptoms. So I started showering every day and working up, and then I started cooking for myself every day and like forcing myself to do that. Just like it helped when I moved out, because I couldn't afford rent and to order food all the time. So to eat, I would have to make my own food. So then I started to make my own food, and then you have to do your dishes, and then just slowly, one at a time, just start adding more tasks to your plate. And over time, the smaller ones will come easier, and then you can start getting to the bigger ones, if that makes sense.
Gotcha. Are there any are there like psychoactive compounds? So I think like caffeine counts as one that you have to avoid because they can act on your symptoms, or because you mentioned Red Bull, and then I know it looks like you're vaping now. I've heard that like nicotine helps people with schizoaffective or schizophrenic stuff. Are there any like dietary choices you make that help you with things, or?
Yeah, so a big thing is like when I get into a depressive episode, especially, that's when I'll sleep for the 12 or 16 hours a day, which is too much sleep. Um, I have to, so I have to take, it's like annoying. So I have to take one med for a GERD in the morning. Then I would usually skip that and just take my Adderall in the morning to get me going, but then it didn't help at all. So because I wasn't eating breakfast at all, because I just felt like I didn't need it, because when I was going through when you go through a manic episode, you don't feel a need to eat or sleep at all. Like I lost like 40 pounds not working out at all. I just had a manic episode, so I lost all the weight because I didn't feel hungry ever.
Gotcha.
And so um oh god, what was the question? Wait, can you go back to
Oh,
the
just like
question?
yeah, are there like dietary choices that you make that like
Yes.
these types of
Okay.
foods, yeah, enhance
Yeah.
symptoms or
So
whatever?
so now my doctor says like I have to get up and have like a good amount of protein in the morning, like 25 grams of protein first thing in the morning before you take any medication. Any medication, you gotta take some protein in your stomach. And because it's just like, it's kind of common sense. Now that I think about it, I should have just been eating breakfast and lunch, but protein is a really big one if you want energy throughout the day. When it comes to vitamins, there are some vitamins that help give you energy. L-threosin, I don't remember the names of them. There's vitamins I have to take as well,
Sure.
and supplements, and it's mostly just to increase the energy levels, um, for the negative symptoms.
Gotcha. Yeah. So for things like the sleep and everything, okay. Do you have big problems with like memory stuff, or is that not as big a problem for you?
So, your working memory is usually pretty effective. For me, I can't remember much. When I try to think 2 years in the past, like that's pretty much gone. Like I have a very hard time. A lot of my problem is like not knowing how people without schizoaffective kind of work, like
Oh, so
do
it's hard to
people
know like
actually,
what's normal versus like what's you having
yeah,
symptoms, yeah.
it gets really difficult because I think like people will talk about their childhood in detail and they can like picture it in their head. Like I can know facts like um I lived with my cousin when I lived in Florida. Like I can remember facts, but I don't remember what it looks like, what it felt like, or any of that. I
Sure.
don't know if that's normal.
Okay, yeah, I gotcha. Interesting. Yeah, I guess it's really hard to compare memories, yeah.
So, but I will forget things like my surroundings. But that's more of an out of touch reality kind of thing where I don't recognize um, where I am, even if I've been there 100 times, and then you can get lost and stuff because you just don't recognize anything.
Interesting. Are you okay with like stuff like driving or?
Yeah, I drive everywhere. I mean, they don't. I'm not supposed to drive if I become like unresponsive and I can't. Like at work, sometimes like people will be like trying to get my attention. I'm just like blankly staring at the wall in like a catatonic state.
Mm-hmm.
And in those cases, they know to call my mom and have her pick me up.
Sure. Does that happen pretty often, or is that like
No,
pretty rare?
well, I worked from home for like 2 years. I've been 1 year at my new job now where I have to go to the office, and it's only come up like one or two times.
Okay, gotcha, gotcha.
Mhm.
Do you have any weird things in terms of like some people talk about like having an inner monologue or like being able to picture things in their head? Like, are you able to do all of that like pretty well, or?
Well, when I read a book, I can't picture at all what it's trying to describe, and it's really frustrating.
Like you can't get an image, or you can't even understand like the words and the narrative and the grammatical structure.
The images mostly. I have no idea. Like when it's like, I used to get so annoyed when I was a kid, because I'd be reading and I loved reading,
Mm-hmm.
but they'd spend like 2 pages describing a chest, and I'm like, I don't know what the fuck this looks like. I have no idea what they're trying to like. I can't picture it at all when I read
Okay,
the words.
gotcha.
Like it just doesn't connect for me.
Okay. That I don't think it seems like there are people that are like that. It's not necessarily like a schizophrenic thing. They're just people that don't have mental images for whatever reason.
Yeah.
Interesting. All right. Well, I'm trying to think. Is there anything else you want to go over, or?
Um, I don't think so. I mean, pretty much talked about everything I wanted to. Thanks for having me on, though. I appreciate that.
Yeah, no problem. If anything ever comes up, or if you hear anything, or want to talk about anything, or related to this, or any otherwise, yeah, feel free to shoot me another email
Yeah.
or message on Discord. Yeah.
Yeah, if you ever need some, if you ever get into mental health topics, I mean, it's a big part of my life, and I think about it pretty deeply. So if you ever want to chat about that kind of stuff, I might be a different perspective.
Gotcha. Cool. Actually, hold on. Yeah, I kind of have a question. So it sounds like when I listen to you talk, it sounds like you have actually put effort into like reading the actual descriptions of things. Like your description of like what a delusion is like that's like a dictionary definition, like pretty well. Yeah. It seems like there are a lot of people, and not to shit talk anybody, I don't mean like that, but it seems like there are a lot of people with mental illnesses that don't do much research or know much at all about that. Do you have like an opinion on like if you're dealing with a mental illness, like do you think those people should make a bigger effort to get informed, or did that help you, or is it like you wouldn't think most people should waste their time, or what? How do you feel about that?
100%. I think about that a lot because that's why I tried like on my YouTube channel to try to educate people a little. It's a little frustrating that your doctor doesn't educate you. Like my doctor never went over basically most of the symptoms of schizophrenia at all. And I think a lot of people just assume their doctor is giving them the info. Like I wasn't even given a pamphlet or anything. I just because people call me weird growing up my whole childhood. People like, I think you're like mentally ill. Like when I turned 18, my friends like, I think you're schizophrenic, and my whole family laughed at that.
Jesus.
But,
Wait, why did they? What was their outward indication? I'm curious.
that I had schizophrenia?
Yeah.
Well, because I was hallucinating.
Oh, okay.
And
Okay, gotcha. It was. Yeah. Okay.
Yeah, he was right. Like he had a good indication and he also said I smelled really bad, which I'm embarrassed about. Not really. I don't really care. But I wasn't having good hygiene, which is a really big symptom. Is like you're really bad at taking care of yourself. He thought he had schizophrenia, so he Googled it.
Gotcha. Makes sense. Gotcha. I know that like the hygiene and stuff
Yeah.
can be an indicator for a lot of like depression and stuff too. When people just suddenly stop taking care of themselves and everything, it can be a big one. Yeah.
And then for me, I think I always was trying to, because like at first, like, I don't blame anyone in my family, but my dad's like 100% Vietnamese. He's from Vietnam. And then my mom grew up in a family that didn't take mental health very seriously at all. I didn't even know it ran in my family. But so I was born in the day and age where I had a phone and stuff. And once I got my diagnosis, I was like, and they made it sound serious, but they didn't explain it. I was like, I need to understand these things. So I think it helps you get better because have more insight. You're like, oh, this is not what sounds exactly like this dictionary definition symptom,
Gotcha.
So now I know that that's probably that, and I should probably go call my doctor because I don't usually do that.
When you first got your diagnosis, were you resistant to it, or were you like, it can't be this or something like this? I imagine because before you have it, I'm sure that all the same stigma that society has, you would probably have as well, right? Like or did you think of schizophrenics as just like crazy people screaming in the street, or?
Like I said, I grew up in a household where they didn't talk about mental illness at all. I was
Oh,
like,
so
not even.
you didn't even have a negative impression. You just had no impression.
I had the impression of like this is the thing that some people I hear other people experience. It's kind of like you get a sinking feeling like oh shit, but at the same time you also you feel like if especially if you've been had a psychotic episode, you feel like oh thank God now they'll know how to fix it because if they didn't know what was wrong, then then I would be stuck in the same situation forever.
Mm-hmm.
But I also was given an MMPI. I don't know if you know what the MMPI is.
No, I don't know.
It's one of the two like national like diagnostic tools that are used like test wise.
Oh, is it like an inventory basically for checking off symptoms kind of? Okay, gotcha.
Mm-hmm. So I took that and it indicated that it had a couple things I could have, and one of them was schizophrenia. And then a couple months later, I was dealing with such severe paranoia that they were like, you definitely have it. So I kind of was given a pre-warning to it because I always thought hallucinating was normal my whole life. Like I didn't think twice about it because for me it was never like I don't like saying it too much, but I don't really have that like super severe case where I need to be institutionalized or anything. It's a spectrum just like how we said, it's a spectrum just like autism. So the hallucinations I've had, like they never really talked to me and told me to do horrible things to the people around me. I've had one voice talk to me once. It was scary, but like it doesn't happen a lot.
Yeah, I gotcha.
So I just kind of assumed like I was talking about the friends, like yeah, because the first time I even heard the word hallucination was because I was taking psychedelics and someone was like, "Are you hallucinating?" I was like, "What does that mean?" And then I was like, "Oh yeah, I do that all the time." And so then I don't know. I guess it plays in the role of negative symptoms where you don't feel very strongly towards things.
Gotcha.
Don't have very,
Oh, the blunt effect, I think is the name, right?
Yeah.
What you were talking about? Yeah.
like apathy. It's just like, okay, I guess this is what's going on now. It's gotten depressing at sometimes. There is one statistic that I've always thought was really, I never understood until someone explained it, but there's a statistic that, okay, so there's schizophrenics who have episode after episode after episode, and there are schizophrenics that go into remission more often, right?
Okay.
Which one do you think has a higher chance of suicide?
Let's see. I feel like it could go either way. Either the ones that have it more often are more likely to commit suicide because they're dealing with it more often, or the ones that have it less often are more likely to commit suicide because they're not as used to dealing with the symptoms. So I could see it going either way. Yeah, is it?
The theory is that, so when you go into remission more, you're more likely to kill yourself, statistics show, because then when you're not having episodes, when you're in touch with the reality, when everything's residual, you have a chance to see what your life is like. And sometimes when you are having episodes, so like you come out of a manic episode, you have no money, you've been doing drugs and stuff all this time, and then you're out of it and you're like, why the fuck did I do all of that stuff? Like, that's not who I am. It almost feels like it's not who I am, but you do all this horrible stuff when you're in the midst of psychosis. You come out of it, you're like, I just want to be normal. Now I have no money. Now I feel like maybe they fired you at your job because you did XYZ. Maybe you got caught for shoplifting during your episode. All these horrible things happen, and then you're like, God damn it, it's gonna happen again at some point, isn't it? And it probably will. Like, not to sound depressing, I'm not too depressed about it anymore. I've kind of let it go, but that's why more people commit suicide when they have more episodes of remission.
Gotcha. Are you have you heard of any of like the different drug therapies that they're trying with people? Like someone in my chat, I don't know if this guy's schizoaffective, but he just mentioned something about ketamine. Ketamine assisted therapy. It's something that has helped me with my symptoms.
I know ketamine's used for depression. I haven't heard of its use for schizophrenia.
Okay. Maybe he's talking about the depressive side of since you're schizoaffective, maybe.
Yeah. Because I don't know what chemicals dopamine raises in your brain, really. Or how it works, because it used to just be a street drug or used for veterinary purposes. But no, I would say, over the years, we've had the first generation antipsychotics and the second generation antipsychotics, and they're supposed to have lower risks of the movement disorders and other symptoms, but not by too much. I think I've been on most second generation antipsychotics, almost every single one of them.
Mm-hmm.
Um, and, the side effects are something that are probably the greatest problem we have to deal with. I mean, clozapine is one of the most successful at treating schizophrenic patients. It pretty much eliminates positive symptoms for almost very treatment-resistant people. But the amount of side effects that come with it are pretty much they're almost deadly in a way. So
Mm-hmm. Gotcha. Okay, well, I think I can't think of any other questions. Anything else?
no, I don't think so. Yeah. Like I said, thanks again for having me on.
Mm-hmm.
I do think it's important that more people kind of learn about these things and, get some more attention to, help out people who are like disabled due to schizophrenia and have more like social acceptance and see like people can definitely coherently have normal conversations and know about these things. You know what I'm saying?
Mm-hmm.
Like a lot of people think you're just
Yeah.
incomprehensible, but there's a lot of people like me out there. So thank you for letting me have a platform to talk about that.
Yeah, of course. Do you want to link your channel or tell people where they can find you?
Sure, I can do that. In the chat, or can I send it to you? Because I don't have that open.
You can just tell me, and then my people will link it and everything. Yeah.
I think it's just Atypical Anna. I think that's what it's under.
Atypical Anna.
Yeah,
Okay.
you can just search that up. I should be there.
Gotcha.
Awesome. Thank you very much.
Cool. Yeah, thanks a lot. I appreciate the chat.
Yeah, bye.
Bye.